we are Rune Labs, and our product is Strive PD. We are based off in San Francisco, in like the Silicon Valley area, but we are mostly a remote company. I'm actually at the Jersey Shore, not like the TV show, if you've ever seen it. It's not like that. So we're all over the country. And we are a startup company, so there's only about 50 of us, so we are fairly small. We started back in 2019. There is two main components of our platform. There's the component for the clinicians or for the Rocksteady boxing coaches, and then for you as a patient with Parkinson's. This really came about because we noticed how usually you only are able to see a neurologist or movement disorder specialist maybe 3 times a year, 4 times a year if you're lucky. There's a big need for more neurologists and movement disorder specialists in the United States, and the ones that are here are already so busy with hundreds of patients that they usually only have a few minutes to talk to you. Those sessions can be, very quick. So our platform allows them to be able to monitor you like from a distance, in a sense, where they can log in and be able to see how you're doing, any questions that you're having, and really just helps to streamline your conversations when you do go into the clinic. And now we also opened it up to Rocksteady boxing coaches, so they as well can communicate with you through our platform and be able to see exactly what's going on in your day-to-day life outside of the gym, and for your clinician outside of the clinic. So we are an application, an app on the iPhone and the Apple Watch. We are HIPAA compliant disease management care tool. Just as an overview, we allow you to be able to track your symptoms, track your medications, write notes, kind of keep track of everything that's going on in your life and what affects your symptoms. So how it all came about is this lady here, this is Aura. She has Parkinson's herself. She was very tired of bringing notebooks and spreadsheets and all of this information to her neurologist appointments all the time and trying to categorize things and keep track of her medications. She had a lot of difficulty with her medication scheduling and side effects. So she was always trying to track and keep, figure out what was going on. So she got really tired of all the notebooks, and she also happened to be a software engineer. So she said, I'm gonna make myself an app. And that's what she did. She made Strive PD for herself. We did acquire it from her in 2018, did like a big revamp to it and a lot of improvements to it. But Aura is still part of our patient advisory board. We do have a patient advisory board, people with Parkinson's who weigh in on everything that we do. We make sure that any kind of change that we're gonna make to the application, we always test it first with the people on the patient advisory board and also some of our users who are interested in testing different things before they get released. Because at our core, we always want to make sure we're doing what's best for the user and for the person with Parkinson's. So these are some screenshots here. So like I said, the user has the application on their phone and watch if they have an Apple Watch. And then the clinician or the Rocksteady boxing coach has this nice little portal that they can log into online where they can see some of your symptoms and everything that you've been tracking on the app. Now you do not need an Apple Watch necessarily to use Strive PD. You can just use it on the phone, manually track your symptoms, manually track your medications, your Rocksteady boxing classes, your activities that you're doing. But if you do have an Apple Watch, there's a really cool feature, and I'll get a little bit more into this, but the Apple Watch in June of 2022 received FDA clearance to track 2 things for people with Parkinson's. It will track your tremors and it will track dyskinesia. So those 2 things happen automatically just by wearing the watch. That information then can be uploaded onto your phone, so you can open up the app and see exactly how much tremor you're having, when it tends to happen, and same thing with dyskinesia. That information also uploads onto the clinician portal, so your doctor or your Rocksteady boxing coach who has access to the portal can see, how your tremor is doing, how your dyskinesia is doing, when it happens, what makes it worse, what makes it better, how it's affected by the timing of your medications. So this really came about and was an exciting feature for us because a lot of clinicians have been using it to titrate or figure out better scheduling of medications for their patients based off of this data. Before it was more you would just go to the clinic and they'd say, how's your tremor? And you'd say, I think it's better, I think it's worse. But now they have this actual quantifiable objective data in front of them that helps them to make better clinical decisions. And then of course, you as a user and someone with Parkinson's, you can start to see how you can maybe get a better handle on some of your symptoms, what makes them better, what makes them worse. So like I said, automatically the symptoms of tremor and dyskinesia are recorded by the Apple Watch. You can learn from these patterns and behaviors, figure out what makes them worse, what makes them better. This improves your communication with your care team or your Rocksteady boxing coach, and then enables them to view your symptoms and your data all in one place. This is a little bit repetitive here, but taking better control of your journey, tracking things, what makes you feel better, what makes you feel worse, get an analysis of your daily symptoms, and be prepared when talking to your clinician. So maybe you start to notice a pattern, you'll be able to bring that up at your next appointment and really be able to hone in on what's going on and what improvements can be made to your treatment plan. So I talk about data, and I'm sure if you turn on the news or read the paper, data is now everywhere and everything. Artificial intelligence, we're in this new realm of technology. So where is this data coming from? What is it? So this is a little breakdown of where we're getting this information. So just as a little note, we are only iPhone and Apple Watch compatible. So unfortunately, if you have an Android, like a Samsung or a Google, we don't work with them. Their platform doesn't, our platform doesn't work with their technology. So there's one reason for this. Apple right now is the only one who has this FDA cleared ability to track tremor and dyskinesia. Google Watch doesn't have it yet. Fitbits, the Oura Ring, those do not have it yet. We really do hope in the future that they do. It seems like Apple tends to be the first when it comes to healthcare, really diving into that. So we hope that these other companies do this as well, because we would love to have our app be available on Android phones as well. But right now it's only the iPhone and the Apple Watch. And it's also only the iPhone, you can see up at the top there, 10R, 10S, 10S Max. I didn't even know these existed. I thought it was just a 10, but apparently there's different categories of the 10. And then iPhone 11, SE, 12, 13, 14, 15. So if you have an iPhone 8 or 7 or 6 or something below those, this platform doesn't work with that. And that's just because of the software updates that have to happen on your phone. So you have to have an iPhone XR or above. And then for the Apple Watch, an Apple Watch 5 or above. So getting back to the data, the Apple Health Kit data. So if you are familiar with Apple products, if you have an iPhone already, you may notice that there's a little application on your iPhone. It's called Health. It's white with like a little pink heart on it. That stores all of your health information. So your iPhone, if you carry it in your pocket when you're walking around, it actually can detect your walking speed. It can detect your steadiness of your walking, your stride length, automatically just by having it in your pocket. The Apple Watch as well, if you have one already, you probably are familiar that it can do your heart rate, it can track your sleep, all this information. All of that goes into what's called the Apple Health Kit. We are able to pull things from that Apple Health Kit onto our app so that you can be able to see it all in one place. So right now, your doctor or your Rocksteady boxing coach on their clinician platform would be able to see how much sleep you're getting, your mobility and your gait metrics, which can be really great if you're having some gait issues, your doctor can see maybe over a couple months, see a decline in your walking speed, and then intervene and say, hey, maybe you should go to physical therapy, or maybe you should start going to Rock City Boxing more times a week. So you can really try and get in there before things get worse or before a fall happens. Activity as well can be pulled in. So if you have an Apple Watch and you use the little workout app that's on the Apple Watch, that will automatically be collected as well. We can have that display. And then heart rate metrics. This isn't yet in our app or in the clinician portal, but it's something I'm really pushing for. We know that exercise is so great for those with Parkinson's, but not just exercise, but the intensity of the exercise. So higher intensity exercise tends to have a better impact on your symptoms and is more disease modifying for the individual. So we do want to get the heart rate metrics in there soon. Our engineers are working very hard at that, just so that your doctor can see and your Rock City Boxing coach can see, how intense you're working out. The second box there is the Apple Movement Disorder Kit. This is the thing that only Apple has at the moment right now, and that is that 510K FDA clearance ability to track your tremors and dyskinesia just by wearing the watch. You don't have to do anything else except wear it, and that information will automatically populate into Strive PD on your phone, and then also onto the portal for your doctor and your coach to see. The last box there is any self-reported information that you put into our app. So you can set up a medication schedule. You can input other symptoms you're having, because we all know everyone's different. Everyone's Parkinson's journey is different. So if you're struggling with anxiety or constipation or dizziness, blood pressure issues, you can manually put those into the app, kind of like a diary, and keep track of those things. And then also, if you don't have the Apple Watch, you can manually go in and put in the activities you're doing. If you did a Rock Steady boxing class, or you went for a walk that day, you can input that information as well. So here's a couple little screenshots of what the app looks like, some different screens of it. If you look all the way over to the left where it says Hello Janet, you'll see those blue and green lines across the days of the week. So this is where you'll see your tremor and your dyskinesia information if you do have an Apple Watch. If you don't have an Apple Watch, this will just be blank. There won't be information in there. You'll also be able to open up that information and see day to day, hour by hour, how your tremor and dyskinesia is doing as well. Then if you look all the way over to the right where it says, what do you want to log? This is on the app on the phone where you can go in and you can manually input any information. So I touched on this a little bit, but symptom or side effect, so that's anything that's going on that you want your doctor to know about, or maybe you want to be tracking. Medications, you can set up your medication schedule. The phone or the watch can also, you can set it up so that it gives you a reminder when your medication is due. So if you find yourself accidentally skipping doses or forgetting to take a dose, you can set it up so that a little ding or vibrate will go off to remind you to take your medication. There's also influence, which is really anything that affects your symptoms. So food, sleep, activity. There's other categories in there like stress. I have a gentleman who you can input your own little category that you want to log, and he put stress, and it was anytime that his mother-in-law came into town, he would log it because his tremors would get worse because he'd get stressed out, and that's, hey, whatever floats your boat. So you can add your own custom things into these categories as well. DBS, or deep brain stimulation. The iPhone and the Apple Watch aren't connected. If you do have a DBS implant, it's not connected to that in any way. But if you want to manually just put in what setting you're on that day, some people have the ability to change their settings day to day. If their doctor allows that, they can input that just to keep a log of what their settings are at. Last one is, or second to last one is Note. I love this feature. It's just a free space where you can ask anything, put anything in there. You can write a question that maybe you want to remember to ask your doctor. You can write about an event, maybe you had a fall and you want to describe what happened. Some people use it as an emotional outlet. If they're just having a bad day, they can write it in their note. It will be time-stamped and it will be date-stamped, and it also will go up into the clinician portal. So they'll be able to see it as well if you want to communicate anything with your doctor. The last thing is motor diary. That's not yet available, but that's going to be for tracking your on and off times. So a very quick, easy way to just track when your medication's wearing off or when you feel on with your medications. The next slide, I think, yes. We also enabled Siri recently, so you can track your medications and your symptoms with Siri for now. We are hoping to get more of the features involved that can use Siri, but right now it's just medications and symptoms. You can talk to your watch or your phone and have it quickly logged that way as well. We do know some days can be tough with the tremor or the dexterity maybe for typing or clicking on things on the screen. So we recently launched this feature as well. So activity, I'm sure you're all here, you probably all are very much involved in activity and exercise, which is great. We know this is the only disease-modifying intervention at this time for those with Parkinson's. It can help slow your symptoms. People are now finding in research that it might be preventative or neuroprotective for your brain. So we love everything exercise. It's such a key part of anyone who gets diagnosed with Parkinson's. They really should get a prescription for going to Rocksteady or going to physical therapy, because it's just such an important part to have as part of your care plan. So we wanted to make sure we had activity section in our app. You can see here where it says 10-day streak on the screen. We have this little kind of competitive edge where if you track every day what activity you're doing, whether it's walking or going swimming or physical therapy, whatever you're doing, if you do consecutive days in a row, it will put you on a streak and you can try and beat your longest streak. Most of these Rocksteady gyms that I've talked to are doing a lot of competitions where like who can get the longest streak, then they get a prize. So this is kind of just a little fun, encouraging feature. Some people get very competitive about it. And then you can see here, there's all different options of things that you can log. These are just a few of the things like Rocksteady, flexibility, walking, rest day. There's a whole long list there more. And you can also add your own custom activity that you do if it's not on that list. Now this is if you go into the app and you manually do it. Again, if you have an Apple Watch and you use your Apple Watch to track your workouts already, as long as you start a workout on your watch and then you end it, it will automatically pull into Strive PD, so you won't have to go in and log it. It will be there already. This is giving you a little bit more detailed view of the tremor and dyskinesia information that comes from the Apple Watch. So when you go to look at your day-to-day tremor and dyskinesia from the watch, it will show up like this. It will have tremor, your total amount of tremor for that day. So here it says 45 minutes. And then dyskinesia, which would say 7 minutes here. You'll see these blue and green lines along the graph. This is to show you kind of where the tremor tends to spike throughout the day. I can't do it here on the PowerPoint, but on your actual phone, you can click on the graph and you can see hour by hour. So it will say, between 4 and 5 p.m., you had 3 minutes of tremor. So it really breaks down each hour so you can see what is influencing your symptoms. If you put your medications into our app, they'll also show up on this graph, so you can start to make the correlation between I took my medication, 30 minutes later I noticed my tremor started going down. Also activities, so you do a Rocksteady boxing class in the morning, and then maybe later in the day you'll be able to see, oh, my symptoms look a lot better. Or sometimes right after the classes your symptoms spike up and get a little bit worse because you're tired and fatigued, but then you start to see it go down. There's also a neat feature where You can look at a week view, so you can go and see the past 7 days. You can see 2 weeks, a month, or 3 months, which is really nice because then you can see that graph line and be able to see how your symptoms changed over a long period of time. This can be really beneficial if you started a new medication and you want to see how it's affected your tremor, or if you have a DBS and you change the settings or have some sort of adjustment to it, you can start to see exactly how much change was occurring over a long period of time. We are excited that recently, it was, I think in July, we announced our partnership with Rocksteady Boxing. I reached out to Ryan Cotton, the CEO, and he was very interested. So they're going to actually be working with us a little bit. We might be doing a study of some sort, some research to kind of see how Rocksteady Boxing affects tremor dyskinesia over time, and seeing, you know, someone who goes once a week versus someone who goes 4 times a week, and like how those changes occur. So we're excited to partner with them. For now, we're just, we have their logo in our app, so you can not just say that you did boxing, you can specifically say you did Rocksteady Boxing on our app and be able to see how that has a change on your symptoms. Here's just some quotes from some Strive PD users. Right now we have about 3,000 people on the platform in the United States. And then we have 260 clinicians at the moment who are using our clinician portal, movement disorder specialist and neurologist. Rocksteady Boxing coaches, I believe we have about 50 throughout the United States, and it's my job right now to get more of them. So if you have a Rocksteady Boxing coach who isn't already involved, or you know someone across the country who does Rocksteady, please let them know about Strive PD, because it's up to me to get more of them. So here's some quotes. The fact that Strive gives you a notation where you can make a note about anything you enter was very useful. I could tell the doctor explicitly when it occurred and how long it would last. It was also a good emotional outlet to be able to talk about what was happening through writing. Another user said, I realized I'm learning more about my tremors, how it works and what sets it off. It's not regular. I'm learning about the external factors that might affect the tremors. In other words, if I sit down and watch TV for an afternoon and the next day I go on a hike in the afternoon, how it affects the tremor. So you can really see how your activity affects your symptoms. Like I said, we have 260 plus clinicians across the United States, and we are in 150 plus clinical sites, hospitals, some are private practices, things of that nature. If your clinician does have a partnership with us, they are part of Strive PD, then you get a little bit more support in that you can have an onboarding session with one of our patient specialists, either me or we have 3 others, where we'll walk you through on Zoom all the different features of Strive PD, answer all of your questions. But even if your clinician is not partnered with us, you can download it for free from the App Store and use it yourself. We do encourage you, if you really like Strive PD, to have your clinician reach out to us. It's free for clinicians to use as well. There's no subscription for them to have access to the portal. Same thing with Rocksteady Boxing coaches. All they do is meet with either myself or we have a couple other clinician specialists as well, who will just train them how to use the portal, how to log in, and how to read the information that's on there. But it is free for them, no subscription. So if you have a doctor who might be interested, definitely have them reach out to us, and I'll give you the information at the end of this presentation of how they can reach out to us. So here is, you can either scan this with your phone, I don't know if with this being up on the projector, if that will work, but you can register with us if you're interested, strivepd.com, it's a pretty simple domain name. So if you do that and you register with us, it will ask you who your doctor is and what clinic you go to. As long as your clinic is a part of our Strive PD network, you'll get access to a one-on-one onboarding appointment with one of our patient specialists. Again, if you have a doctor or a clinic that you go to that is not part of Strive PD, no worries. You can still use the app. You can, reach out to us, ask us questions, that's no problem. And then we'll also give you that information on if your doctor's interested, how they can reach us and get part of our Strive PD network. Now, if you are interested in your Rocksteady boxing coach, so Premier Health already is part of Strive PD. That's why I'm here. So Eric and Erica both already have access to the portal. So if they are who you see for your exercise and activity in Rocksteady boxing, you're already good to go. Just make sure that you do register as a boxer. So Eric and Erica both have flyers that have a little link to register as a boxer. Then I can put you in their little list there so that they can see your tremor, your dyskinesia, your activities and symptoms and things of that nature. Now, of course, if you don't want anyone seeing your data or your information, that's fine too. You don't have to register. You can still use Strive PD. Just download it from the Apple App Store and use it for your journey if you would like. So that is everything. If you do have questions, at the very bottom of the screen, you'll see it says support@roomlabs.io. That's the easiest way to reach out to us for any questions, concerns, how to get started. That email goes to myself and also the 3 other patient specialists. So we do try and get back to you within 1 to 2 business days. If you have any questions, concerns, if you download the app, you're confused how to sign up, having issues or glitches, just let us know and we can assist you.
And then we can also always help you as well.
I can leave that up if you want. Are there any questions that I know that was a lot of information, so any questions I can assist you with?
Let's see, I have a question. So I don't know if our clinic is or knows about this Strive PD, and what would be the best contact and the best introduction to them?
Great. Not a problem. The email that's right down there, it says support@roomlabs.io. If you just want to email, that will go to me and the other patient specialist. Just email us the name of the clinic, well, your name as well. You can say, hi, I was in the support group. You can give us the name of the clinic and then the name of your clinician, or if there's multiple clinicians there. And then I'll forward that to our clinician specialist. They'll give them a call or reach out to them and see if they'll be interested in setting it up.
Thank you.
Sure, absolutely.
Any other questions? Yeah, you go ahead.
Kind of a stupid question.
No.
Does it matter what wrist you wear it on to pick up the data?
Great question.
Oh.
Great question. So we do, and the Apple validation study says to put it on the side that you have the most symptoms on. So if you're more tremor dominant on your right side, then you should wear the watch on your right wrist, which I know a lot of people usually wear watches on left, so it can be a little awkward to have it on your right side, but to get the most accurate information, that is what they say to do. Also with that point, some people do have tremor in their ankle or in their foot. I've had some people say, can I put the watch on my ankle? Unfortunately, the FDA clearance is not for use of the ankle. It's only for wrist use. So the watch most likely would not pick up tremor that is that far away from the wrist. It's most predominantly going to pick up the tremor that's up in the upper body region.
Thank you.
I have a question.
Sure.
Say that the watch will monitor your sleep.
Mm-hmm.
When do you charge your watch? Do you wear it during the night when you're sleeping?
Great question also. So the watch typically, depending on what watch type you have, typically needs to be charged once a day, once every 24 hours. So personally what I do is in the evening when I, just sit down for dinner or sit down for, watching TV or reading, you just put it on the charger for about an hour. And then it's usually either fully charged or almost fully charged, and then you can put it back on and it should be good to go throughout the night without dying.
So it will charge that quickly.
Oh yeah.
Yes.
Okay,
Really, a lot of the watches now, that they will charge, within 30 minutes, a full 100% charge in
okay,
within 30
aware of
minutes.
that.
Yep, and some of the watches now, like the more, the ones that we gave to the Rocksteady are Apple Watch SE, which, I mean, they're fairly newer ones, but they have like the Apple Watch Ultra, which I think has a battery life of 3 days, but it's also like $800. So all the watches are a little bit different. But yes, typically once a day you charge it, shouldn't take that long, maybe a half an hour to fully charge, and then you'll be good for the rest of the day.
Thank you.
Any other questions?
And just as a little note for the Apple Watch, and I do not work for Apple, and we do not get anything from Apple. So even, it's not like we get a percentage of people who buy Apple Watches. I wish, but we don't. But the Apple Watch, I have to say, even before I came to Strive PD, I do find it to be not just a nice tool for if you're working out or you want to track, your heart rate or things of that nature. I know it's an investment. I think the Apple Watch SE right now on the Apple site is about $250. So that's a bit of an investment. But I know if my parents, as they get older, would love for them to have an Apple Watch because it has that fall detection. So similar to a life alert, the Apple Watch, if you have a hard fall in the home, it has the ability to notify your emergency contacts. And then also, if you don't respond to the watch, it will send your coordinates to the local EMS. So there was a gentleman who was riding his bike in the woods, and he fell off his bike and he hit his head and he was unconscious, and his watch detected that he had a fall and was able to send those coordinates to the EMS, and they were able to find him and save him. So it has that really great technology, especially if you live alone, that, besides just Strive PD and the things for Parkinson's that it can do, it does have some other really great health features and safety features that are nice.
Yeah, and we're going to try to work on to see about anybody that wants to watch if there is anything Apple can do for us, because we have a partnership with our Apple store here where we have seminars where once a week they go and can look at all the accessibilities, learn how to work everything in the iPhone, the iPad, the Apple Watch, all of that. And so we have a very good relationship with them. So we're going to look at seeing about any type of bulk purchase or type of discounts, or even maybe even refurbed watches or anything like that. So yeah, we're going to be working on that. Yeah.
We tried to talk to them as well, especially being in San Francisco. They're like our neighbors.
Yeah.
And we were trying to see if we could get some sort of discounted rate, but they're very firm with their price point with us, at least. But I hope that they can offer you some sort of discounted rate. You can get a refurbished watch. There's nothing wrong with that. Just make sure it's an Apple Watch 5 or above. You can find those on Amazon and other sites. But yeah, and then I don't know if you can use like a health savings account for an Apple Watch. Things of that nature. I know Medicare is maybe working with Apple as well to see if there's some sort of way that they can get watches to people for different reasons.
Now that they're considered, FDA approved in medical devices as well. So yeah, that should be able to come along. You have a question?
Yes, if you got DBS, your app asks select the sides, left or right. Is that which one it's helping, or where the electrode is?
Where the electrode is on your brain. So I know you have a power pack in your chest,
Yes.
but also where the actual electrodes are in the brain. Some people only have one side. I think the majority of people have both. But yes, it's where the location is on the brain.
Any other questions? I know we've tried to answer a lot of the questions already that we knew about when we were helping everybody sign up. So pretty much everybody in here, I believe, already has it downloaded and signed up and everything like that. And then also we do have where we hopefully we'll be bringing on the University of Louisville's neurology, because they already have said yes, they would like to do that, and so we will get with you on to do that. We've been busy with a few events lately, so I mean, I'll get back with you on that. But yeah, so if you guys have a University of Louisville doctor, Dr. Dare or Dr. Victoria Holliday, they will probably soon be online with this, and then also probably the neurologist might even want to, I meant the neurosurgeon might want to look at it too if you've had DBS through them.
Yes, it's been really great for DBS where they can make better adjustments to the frequencies after you have surgery and see what really improves your tremor. Because before it was a little bit more of a guessing game. You go in and they tune in and they see how you do, and you come back and they do it again. So now it's becoming a bit more of that objective data-driven decision making. But yes, we're very excited. We'll do a presentation for them that's more catered towards, you know, what kind of things they'll get from the clinician portal. And I'll probably bring on Amanda, who is our nurse practitioner, and Hannah, who also has been working with clinicians, and we'll do like a group one for all of them. Also, if you have the physical therapists from there as well, we're starting to open up the portal to physical therapists so they can track their patients, you know, gait speeds and mobility metrics on the portal as well, so they can feel free to join too.
Okay, awesome.
Mm-hmm.
How are you being compensated?
That's a great question. So if everything's free, how do we make money? So we do work with a lot of universities, UCSF. We have some universities actually out in Japan who do a lot of studies, and they give us grants. So we do have grant money, but the majority of our money actually comes from pharmaceutical and clinical trials. So some of the life sciences and medical device companies, Medtronic, if you've heard of them, they do DBS. They do a lot of studies and clinical trials. So they'll utilize our platform, and we'll set all of their clinical trial participants up with watches and the phones if they don't have iPhones. And we'll store their data, we'll track it, we'll make sure everything is coming through and do that all for them. We do like a white glove service for those companies. So fortunately, pharmaceutical companies have a lot of money, probably too much money, so they pay us as well, and that's how we're able to maintain and keep this free for all users in the United States.
And hopefully we'll be able to have discussions with Rune Labs and things too, that where MPI can you know, start up a couple studies as well, and
Yes.
in conjunction maybe with the university and everything like that. 'Cause with our group so large, you know, the amount of people that we already have signed up and have is just a drop in the bucket right now compared to how large the community actually is
Right.
that we have, and so we'll be getting
Yes.
more and more signed up here in the next coming month. And we have a big walk coming up in April too, so that's something we were going to talk to you about if you guys want to have a presence there. But we also, you know, we will advertise it regardless, because we want everybody that can have this to have this, because as you guys can see from the presentation, this amount of data is, I mean, just think if this was around years ago. I mean, how better you can have your symptoms down, your doctor to be able to fine tune everything for you. This amount of data is just, I mean, it's amazing. And thank goodness that you guys are around me. I mean, because this is a game changer. I think everybody with Parkinson's is eventually going to have this.
Thank you. And yes, this, I have to say, you know, there's other companies out there who have apps for people with Parkinson's, and no disrespect to them, they're great, but we are the only ones with that ability with the Apple Watch to collect that data and be able to display it for both you and your clinician and your coaches. And I have to say, you know, coming from a clinical background and working in hospitals and home health and working with the Parkinson's population, you know, I came into this tech company, and some tech companies are just tech people, you know, they're just software engineers. They don't know anything about the patients. They don't know anything about people's day-to-day lives with Parkinson's. But I have to say that Rune Labs, we truly pride ourselves on having a connection with the community. You know, my grandfather had Parkinson's. I worked with people with Parkinson's. Our COO, her mother, she lives with her, she has Parkinson's. One of our head software engineers, his dad has Parkinson's, so he actually lives with his dad and will do like coding or whatever and create something on the app and then go downstairs into the kitchen and have his dad test it out before releasing it. So we have this very strong connection with the community, and everything that we do is for the community. We do have to make money, obviously, but we do that through the pharmaceutical and the health sciences. But we do pride ourselves on not just being a technology company, that actually be a health company for those with Parkinson's. So it's a great journey. It's been fun, and we hope to keep improving, and we take feedback very seriously. So anything, I have that support email up on the screen. Anything that you like or dislike or are having issues with or you think could be better, please email us that feedback. We do take it seriously, we log it, we have like a whole list, and we may not be able to get to it right away because we are a small company, but we will make sure that it is addressed if we can fix that issue and make it better for you.
Yeah.